Before the break, we read you an email from Paul, a prostate cancer survivor who suffers from erectile dysfunction, or ED. There are a lot of options to help Paul, and urologist Dr. Aaron Spitz is here to show us some of them. I want to thank Paul for asking this question because it's bringing this issue that affects so many men out into the open. Thanks for being here.
Glad to be here.
You know, Dr. Spitz, before we go any further, just explain to everyone what erectile dysfunction is.
Erectile dysfunction, simply put, is when a man has difficulty getting or keeping his penis hard enough for satisfying sex. That's ED.
You've got a model there.
Yes, I do. Let me explain it in a little more detail. It starts with the biggest sex organ, which is right here, between the ears, the brain. The brain sends a signal down to these switches, which are nerves, and the nerves are located right here, and they run right along the bottom of this structure here, which is the prostate.
Which is why men who have prostate cancer oftentimes afterwards suffer from this.
That's true, but it's not the prostate cancer that causes the problem. It's the treatment for the prostate cancer that causes the problem. And here's why. So these switches that run along the prostate on either side are nerves that go right into this structure, which is actually the base of the penis. This is like a balloon, and it runs from inside the body out to the surface of the body and down. So the part of the penis that you see is really only half of it. At the base of the penis, arteries enter and they fill this up with blood. But inside the penis is this spongy tissue that's made up of specialized arteries that are like a sponge. And if that sponge doesn't relax and let that blood in, if it stays tight, then the penis can't fill with blood. And it's the chemicals that are released into that spongy tissue by those switches triggered by the brain that allows that spongy tissue to open up, let the blood flow in, fill up the penis. Now, the penis is made up of these cylinders that are like balloons, but they're pretty remarkable because the tissues that make these balloons are amongst the very strongest materials known to man, whether organic or synthesized. And as they fill, they don't keep stretching or pop, they actually get hard.
You were fine before you had treatment for prostate cancer.
Yes.
And since the cancer, I also know that you do use the pills.
Yes.
And explain to us, how is the little blue pill helping us, Dr. Spitz?
Well, remember I said there's those key switches that run right alongside the prostate? When he had his surgery, they removed the prostate, and in so doing, they damaged the switches. So when the switches are damaged, they can't put that chemical, or as much of that chemical, into the penis where it activates that relaxation. What these remarkable pills do is they allow those chemicals that are released, because some degree of chemicals do get released into the penis even though the switches are injured, they allow the chemicals that do manage to get in there to last longer. Normally our body will allow those chemicals to last a little while, then they'll get rid of them. Otherwise you got too much of a good thing.
There are other things. There's the vacuum.
The vacuum is a closed cylinder that's placed on the flaccid penis. When I press this button, it kicks on, sucks the air out, draws blood up into the penis because of that vacuum in the chamber. The blood rushes up into the penis, and when the penis is fully erect, there's this band that's at the base of the penis that just gets slipped off, trapping the blood in the penis, keeping it erect, and then the patient is able to have sex.
For how long?
Well, he can have sex for as long as he desires. You know, a minute. No. And then when he's done, he releases the band, and then it goes down. Now, going on to other treatments, there's an injection.
And I find this really intriguing because this is an injection that you would give to yourself.
People with diabetes do it all the time. This medication is called prostaglandin. And what this is putting those chemicals that I talked about that the nerve switches release into the penis, it puts those chemicals directly into the penis. The pills let the chemicals that are there work better. This gives you extra chemicals directly where it needs to go.
And you inject it into the penis.
Patients that do it under my supervision the first time in the office are always surprised how little it hurt or didn't hurt at all. For men whose underlying conditions, which are conditions that affect blood vessels, that would be atherosclerotic heart disease, the same condition that clogs up the arteries to your heart, clogs up the arteries to the penis, or medications that affect the nerves like blood pressure pills, or smoking, hardening of the arteries, using marijuana, alcohol abuse, all the things that affect the blood flow to the penis or the nerves. If the condition is so severe that the pills can't overcome it with the body's own chemicals, and directly injecting the chemicals into the penis isn't enough, and the vacuum isn't satisfactory, you can still have an erection with a penile implant. This balloon is positioned next to the bladder, inside your body. All the components are completely internal. There's nothing that ever sticks out. It's totally internal. It's totally private. So what happens is this is next to the bladder. This is implanted in the scrotum near the testicle. The man simply reaches to his scrotum and gives it a couple of pumps, and the evening is restored. Normally, to deflate the penis, you have to pump it again, and it's a little bit tricky. With this model, you just give it a single squeeze, and then the penis will deflate.
The moral of the story is there is hope. How does that make you feel?
That's great.